Hello everyone, my name is Dr. Mohammad Uwais Aziz and I'm a professor of sciences at St. Lawrence College in Cornwall, Ontario. So I thought let's start a discussion on integrating artificial intelligence in medical education. And I'm going to present my perspective with the help of a case scenario and how we can teach our students by integrating the concepts or the knowledge which we are generating every day and how advancement in the science and technologies are shaping our future and our current medical education. So let's start discussion and I'm going to show you a case scenario now. Now, this is a case scenario which is a real case scenario, and I have picked it up from Connecticut Malpractice Suit, and I have modified some details of it. Now, what happened that a 31-year-old woman was admitted for labor pain at 38 week of gestation. She was a primary gravida. So Dr. RV kept her in observation and waited for normal vaginal delivery, continued to monitor fetal activities after 24 hours of continued labor. Dr. RV decided to perform a C-section because of the prolonged labor. And the child was born with obvious signs of birth asphyxia, such as the child was born pale, limp, and was not breathing. So, anyways, after resuscitation, the child was kept on ventilator and later diagnosed with cerebral palsy and was paralyzed for the lifetime. And later on, the family sued Dr. RV for delaying C-section and won US $58 million in court. So now for our student, even at undergrad level, a case scenario like this might be triggering and they may think like how they can save themselves from getting sued or getting into consequences of a wrong decision or a delayed decision, I can say. So here the machine learning or the modern AI can help students or help the healthcare professionals to avert a bad consequences or a malpractice suits or any of the suits in their lifetime, and they may end up saving lives with the help of machine learning or AI. Now, this is an MRI image of a woman who is in labor, and here machine learning or artificial intelligence calculated what would be the appropriate dose of radiation, which would be non-lethal or which will be not causing any harm to child or the mother. So, with the help of this MRI, a pelvimetry was performed by artificial intelligence. The child weight and child dimension was calculated by artificial intelligence, and ultimately artificial intelligence was able to make decision whether doctors should wait for normal vaginal delivery or they should go immediately for LSCS, or you can say like a cesarean section. So this is one of the hardest decision during labor time, and it is made with the help of AI, and AI can help us in making those decisions, and it will ultimately prevent the consequences of prolonged labor, or it will prevent the consequences or the bad effect on the child here. And imagine like in future these techniques or these devices would be widely spread, and it might be in every labor room available, and it may or it will make it easy for healthcare professionals to make hard decisions which are evidence based. Now, quickly, I will share these 5 articles which are published within last 3 or 4 years, and how the advancement of AI is moderating or it's changing the landscape of human education or medical education. And as an anatomist, I just choose these articles from the anatomy education. Now, in the first research, they have mentioned about creating chatbots, and chatbots were so specialized and they will answer all the questions which students have. So students just have to type in their question. The chatbot will answer their question. Same type of chatbot you might have seen or observed in ChatGPT, but the limitation for ChatGPT is the resources which is taking information from might not be authentic or accurate. But here in this chatbot, they use the resources which were generated and or used by health professionals or health professionals educators. Now, the second study is about helping in diagnosis of different diseases, like how AI can help you in diagnosis of different diseases. You can see the same example if you apply on the last case scenario where it was helping to make decision whether to perform a normal vaginal delivery or to go for cesarean section quickly. Another example of this diagnosis is that there are people who are working on different data sources. They are collecting data sources ultimately. So if you will take a picture of a mole or a mark or any abnormalities on your skin, so that picture, AI is going to diagnose with the help of that picture whether this is something benign or it is malignant or you need certain intervention. Even AI will diagnose what is the stage of tumor if it is a tumor. And then when it's come to the virtual anatomy, it is such a fascinating thing, and there are huge things which we can discuss. The Of course, AI, AR or augmented reality is something which is fun where once you wear certain glasses or certain devices, if you're seeing a cadaver, so that artificial intelligence will mark that those parts in front of you. So imagine using those augmented reality devices in our cadaveric lab where you don't have to teach name of each muscle, nerve or everything to students. So your augmented reality glasses will mark that to that student and student will read that. So another thing which you can apply in surgery is that you can download a complete image of an individual or of a patient. You can wear gloves or simulated gloves in simulated environment, and those gloves will make you feel that you are performing real surgery. So honestly, like, the concept of dissection would be taken away here. In the virtual environment, you can perform a surgery, and with the help of virtual reality you can learn in details about those things. And you can imagine like the cost associated with the cadavers. And again, if the error was done on real cadaver, here those errors could be reversed and the student learning will not be affected. Now, the next article mentioned that it can observe the pattern or the behavior of a student, and this software can predict whether these students are prone to failing in the class. And ultimately, as an instructors, we can intervene there and prevent a bad consequences for our students. The final article which I will mention here mention about the personalization of assessment for an individual. So, for example, it is going to find, like, for example, in an anatomy class, a student is weak in respiratory system, so personalized assessment will say like this student is good in all other systems or systemic anatomy, whereas this student may need more learning towards respiratory system. So that student will get more quizzes, more questions, or more things from the respiratory system, and ultimately it will direct students learning, or it will enhance student learning in that specific arena or in that specific area. Now, here is a brief list of the issues which we may face as an anatomy educator by integrating AI in our learning. For example, anatomy structures varies across different individuals. So all individual will have different structures and there might be variation in them. So it may generate a false concept of normal there. So for example, the variation may be considered as a disease in certain individual where it might be not a disease, and ultimately this knowledge would be finite, and there is just a small amount of data which will be making AI to make decisions, whereas the human are infinite and we are variating at every aspect in our personal aspects and other anatomical aspects as well, and even our functional aspects, we are also different from other individual. Now the second thing which comes in my mind was like AI will make diagnosis with the help of like AI. You can make diagnosis, and ultimately students will not get an opportunity to learn or to interact with real humans. So they may not learn the non-technical or non-disciplinary independent skills such as like how to treat with patient, how to talk with them, how to be considerate of the problems of that patient, how to know the social determinants of health, because AI is just making decisions based on the data we are going to put into there. And again, if AI is making like the data is coming from all the rich people, now you can imagine that the issues with the poor people will not be addressed. So here you can imagine that again, a issue of racism might be there, and a bias might be there, because data might be coming from one specific country or one specific region of the world, and AI is making decision based on that. But there are variations in diseases, in issues around the globe. And then comes the next important point where human student support might become difficult here, because AI is just going to determine the pattern a student might be performing well. All of the sudden, certain incident happen in the in the family or in the surrounding of the student. So a student is lost at that time. So sometimes as an educator, we make decisions based on individual need or individual students need. And again, when AI make a wrong prediction or inaccurate prediction, where we will be standing, like we will support the data or we will support what we will be looking with our own eyes. And last point which I want to make here is that student learning engagement might get affected. Like how you will ensure that a student is continuously engaged in the learning process. So there are so much diversion right now. Maybe a student may divert away from your learning thing and they will just jump into playing a game, playing Roblox, playing some other games there. So these are some of the challenges which I think associated with this information. And again, there could be data leak which can breach the privacy of patients as well as of our students or even our instructors. I will just end my this discussion by saying that the society around us or the technology around us is evolving very quickly and very fast. We have to adopt to the change which are happening in our surrounding. We have to integrate AI somehow in our education, in our curriculum, in our assessment, in all steps of pedagogy. So that's how we can design or we can train the healthcare for the future. And this presentation does not encompass all the things or all the aspects of AI education. I just want to start discussion on this topic and especially integrating AI or machine learning in our healthcare professional education. Thank you. And I'm going to show you, I'm going to upload the references in next slide. You can go and read those resources. Have fun and enjoy science.